Auzubillahiminashaitanirrajim. Bismillahirrahmanirrahim. My name is Faryal Razak and my roll number is 1 EP1770038. My group number is 20, and today the topic of my presentation which I am going to present is tobacco uses and dependence. Before starting about the tobacco uses and its dependence, what is basically the tobacco? So tobacco is a kind of a drug drug material, so which is basically used by the many of the large population around the world, and become addicted to this drug material. So tobacco use is the largest single preventable cause of illness and the premature deaths. Since 1955, tobacco use has been leading cause of cancer death in men and in women since 1986. About 10 million deaths would be caused by tobacco use annually by the year 2030 if currently smoking patterns continue. About 1 in 5 adults smoke, and 4 out of 10 non smokers, around 40%, are exposed to the second hand smoke, and smoking rates are higher among the people with a lower education level. Methods of the tobacco consumption: there are a lot of methods by which the people consume the tobacco, or basically there are a lot of products by which the tobacco consumption is widely used now. So basically, smokeless tobacco, and another is burned tobacco. If we talk about the smokeless tobacco category, that includes the chewing tobacco, snuffs, creamy snuffs, dipping tobaccos, and one is that is very common, that is gutka. Now, if we talk about the burnt tobacco, that is a cigarette, it includes basically the cigarette smoking, cigar smoking, bidi, and hookah. There are a lot of health risks of the smoking, which includes the myocardial infarctions, stroke, COPD, asthma, lung cancer, larynx cancer, oral cancer, esophageal cancer, kidney cancer, and the pancreas cancer, and much more like that. What is tobacco dependence? The dependence occurs when you need tobacco and can't stop using it. Nicotine is the chemical in the tobacco that makes it hard to quit. The nicotine produces pleasing effects in your brain, but these effects are temporary. So people reach for another cigarette or these smoking materials. 5 A's to offer tobacco dependence. That is, first is one is the ask about tobacco use, then advice, willingness to make a quit attempt, assist. Third is assist it in which it quite attempt, and the last one is arrange. That is for follow up. Now, the drugs used to treat the tobacco use and the dependence. If we talk about the therapy, we have two types of therapy. One is that we can treat the nicotine dependence or the usage by the nicotine replacement therapies and non-nicotine prescription medications. So if we talk about the nicotine replacement therapy, or the category in which we have two types of further classes, that over the counter, that is, for example, nicotine patch, gum, and the lozenges. And if we talk about the prescription, that is, for example, nicotine inhalers and nasal sprays. Now, what are the non-nicotine prescription medications? It includes basically mainly two drugs, that is the bupropion and the varenicline. Now, if we talk about the details of the nicotine replacement therapy, there are at least three mechanisms by which NRT, or nicotine replacement therapy, could be effective, which are as follows: reducing general withdrawal symptoms, thus allowing people to learn to get by without cigarettes. The second is reducing the reinforcing effects of the tobacco delivered nicotine, and the third one is the exerting some physiological efforts on the mood and the attention states. Now, there are 6 types of nicotine replacement products currently available in the market, which are as follows, which includes the transdermal nicotine patches, nicotine nasal spray, nicotine gums, nicotine lozenges, sublingual nicotine tablet, and the nicotine inhalers. These are some of the products which I have mentioned earlier, in which we can clearly see the lozenges, tablets, nicotine patches, nicotine sprays, nasal sprays, basically. So we have a lot of nicotine products by which we can treat or cure the dependence of the tobacco. this is the another graph by which we teen smoking abstinence rates during the treatment shows a graph of the nicotine abstinence rates during the treatment, by which the nicotine patches and the placebos decreases by the time increasing of the treatment. What are the now non-nicotine prescription medications? Non-nicotine prescription medications basically includes the two main medications. One is the bupropion and the second one is the varenicline. If we talk about the bupropion, it is an antidepressant. It has a dual mechanism. It inhibits the norepinephrine and the dopamine reuptake. It is non-competitive antagonist of nicotine, and the dose includes around 300 milligram per day, given as the 150 milligram twice a day. And the brand name which is commonly observable, that is the Zyban or the Wellbutrin. Now if we talk about the varenicline, varenicline is a partial nicotine agonist that is selective for the alpha 4 beta 2 nicotinic acetylcholine receptors. It is basically a new drug. It reduces the nicotine withdrawal symptoms. Dose depends upon the severity of the patients. Now, what is the mechanism of action of the varenicline? Varenicline basically includes the nucleus accumbens, ventral tegmental area, and the mesolimbic systems, and it basically block the receptors by which the sodium refluxes influx is happening. So when we block the receptors, beta receptors, this transport will be stopped, and it works by this mechanism. Similarly, if we talk about the mechanism of action of the bupropion, it also includes the many areas like the stratum, nucleus accumbens, prefrontal cortex, substantial nigra, and the ventral tegmental area, which is also known as the VTA. But the main focus of the bupropion is basically the hypothalamus, in which it converts the POMC. From POMC, it basically releases the alpha MSH to convert the alpha MSH into the MC4R, which decreases the appetite plus increase the energy expenditure, which ultimately leads to the weight loss. But if we take the bupropion, it basically block the POMC conversions that help the conversion, that helps to convert the MSH into the MC4R. So bupropion act on that the POMC, as we can see in the figure. Now this is basically the structures of the bupropion and the varenicline. These are basically the 3D structures of both the drugs. Now, what is the case study? And I have collected my case study on the tobacco uses and the dependence. We have that is Nick is a 30-year-old Caucasian male who recently enrolled in the patient panel. He comes in today because he desires to kick the habit of the tobacco use. He had tried to quit before and succeeded twice, only to start up again. He denies any health problems but has a strong family history of the COPD and the lung cancer. His father died of the lung cancer 3 months ago, and he has been dreaming of him since then. He doesn't want to end up the same way. If we talk about the past medical history of the patient, the patient denies any medical problems. He had a vasectomy 4 years age at his ex-wife's request, no other surgeries. He has noticed a recurrent morning cough and increased the production of the mucus over the past 2 months or so on. There is no medication, there is no allergies in the history of the patient. If we talk about the stage of the change, that is the contemplations, and the diagnosis is basically the tobacco abuse and the addiction mainly. Now, if we have read the case study, and now if you we are just proceeding towards the solving that problem कि हमें अब करना क्या है. हमारे साथ एक पेशेंट हमारे पास आ चुका है और उसको एडिक्शन है, वो डिपेंड कर रहा है उसके ऊपर और वो छोड़ना चाह रहा है ये आदत. तो हमें अब उसको क्या ऐसी मेडिकेशन दें या ऐसी क्या थेरेपी, किस थेरेपी के ऊपर उसको लाया जाए और ऐसी क्या डोज उस थेरेपी की सेट की जाए जिससे हमारा पेशेंट फाइनली जो है इसको छोड़कर फर्दर अपनी इस आदत को ख़त्म कर सके और उसके लिए ये हेल्पफुल हो. सो What is the subject? That is the chief complaint of the patient is the desire of the quitting of the tobacco. He tried before to quit this habit but not succeeded. He has no history of any COPD disorder and the lung cancer, but he has noticed a recurrent morning cough and increased mucus production over the past 2 months. What are the objects there? Basically, there it has no medications, no allergies, and no vitals are given or provided to the healthcare professionals. If we talk about the assessment, that is the tobacco dependence is a chronic disease that often requires the repeated interventions and the multiple attempts to quit. Effective treatments exist, however they that can significantly increase the rate of long-term abstinence. Counseling and medications are effective when used by themselves. The combination of counseling and the medications, however, is more effective than either alone. And now if we talk about the plan, so we have two types of basically plans, which by there are two types of plans which can be followed by the any pharmacist or any healthcare professionals to treat the nicotine dependence and the addiction. That is, the first is the non-pharmacological treatment, or basically we can say the patient counseling. That first we counsel the patient, suggest regular exercises to the patient, made a proper and the healthy diet chart for that patient, ask them to stop the smoking, and then we proceed towards the pharmacological treatments. Now, what are the pharmacological treatments? There are two types of pharmacological treatments. First line treatment is basically we can start with the NRT, that is the nicotine replacement therapies. And if we talk about the second line treatment, which includes the bupropion or the varenicline. Now, if we start up with the NRT, it includes basically the nicotine gums, nicotine inhalers, nicotine lozenges. So now when we can discuss one by one what are the nicotine gums. It is basically available in both the regular and the flavored forms. The gum dosage is available in 2 milligrams and the 4 milligram doses. The smokers should use at least one piece every 1 to 2 hours for the first 6 weeks. Then the gum should be used for up to 12 weeks with no more than 24 pieces to be used per day. And common side effects of the gum which are seen or include maybe the mouth soreness, hiccups, dyspepsia, and the jaw aches. Are mainly the adverse effect is basically the jaw ache. These effects are generally mild and the transient, often caused by the patient's chewing technique. This can be elevated by correct chewing techniques. The gum should be chewed slowly until taste emerges, then parked between the cheek and the gum line to facilitate the absorption. The gum should be slowly and intermittently chewed and parked for around 30 minutes or until taste dissipates from the gum. Now, if we talk about in the NRT about nicotine inhalers, then a dose from the nicotine inhalers consists to a puff or inhalation. Each cartridge delivers a total of 1 milligram or 1 mg of the nicotine over 8 inhalations. Recommended dosage in 6 to 16 cartridges per day. Duration of the therapy is up to 6 months. Side effects include side effects include local irritation in the mouth and the throat, coughing, and the rhinitis. The severity of the irritation is mild and the frequency of the symptoms decline with the continuous use. Now, if we talk about the nicotine lozenges, we can also give nicotine lozenges to treat the nicotine dependence and the usage. The nicotine lozenges are available in the 2 milligrams and the 4 mg doses. Generally, smokers should use at least 9 per day in the first 6 months of the therapy, and should be used for up to 12 weeks with no more than 20 lozenges used per day. The 2 milligram is recommended for the smokers that have the first cigarette more than 30 minutes after waking. The 4 mg is used for the patient that have the first cigarette within 30 minutes of the waking. The most common side effects include the nausea, dry mouth, hiccups, and the heartburn. Use of the 4 mg lozenges may also cause increased rates of the headaches and the coughing. The lozenges should be allowed to dissolve in the mouth rather than the chewing or swallowing it. So we should be very careful for this particular problem, that what we really have to do and how we should take it and how much dose we have to take. Now, these all are the NRT treatments, basically includes in the first line of the treatment for the nicotine dependence. If we talk about the nicotine or the tobacco dependence, then we have a second line treatment, that is bupropion or the varenicline. Bupropion treatment should begin 1 to 2 weeks before the quit date. The starting dose for the tobacco cessation is 150 milligram orally every morning for 3 days, then 150 milligram orally twice daily. This dosage should be continued for about 7 to 12 weeks. For long-term dosage use of the bupropion SR, 150 milligram for up to 6 months post quit may be used. And if we talk about the varenicline is an improved non-nicotine agent for smoking cessation, the FDA added a warning regarding the use of this agent. Decreased mood, depressed mood, agitation, changes in the behavior, suicidal ideations, and suicide have been reported in patients attempting to quit smoking when using the varenicline. Any history of the psychiatric illness should be discussed before using this medication, but the side effects of the medication include the nausea, trouble sleeping, and the abnormal or the vivid dreams. The patient should start the varenicline 1 week before the quit date and with a dose of about 0.5 milligram daily for these 3 days, followed by 0.5 mg twice daily for 4 days, followed by 1 milligram twice daily for 3 months. Varenicline is approved for maintenance therapy for up to 6 months. The patient reduce the insomnia problem. The second dose should be taken at dinner time rather than bedtime to reduce the nausea. The medication should be taken on a full stomach. So these are the two drugs which are basically using for the treatment of the tobacco dependence. So I would like to end my presentation on just with just few words that there are a lot of population there is a lot of population which is being addicted to the tobacco, but there are the complete treatments, but these treatments uh, which can work to quit this habit, but they also have their side effects. So the pharmacist or the any healthcare professionals can treat it, but the patient should face some severe side effects and the symptoms, withdrawal symptoms as well. But everything will be possible if patient is willing to quit it. It is not very much difficult. It takes time, but it can be quit. The patient can easily quit this habit. So thank you so much. Allah Hafiz.